Hello and welcome. So today let's learn about magnesium sulfate in PIH. Okay, so use of MagSulf in pregnancy-induced hypertension. Nowadays we also call it as hypertension disorder in pregnancy. This is MagSulf is actually the drug of choice, and so let's learn how to give, when to give, and what all you need to monitor. Okay, so what is magnesium sulfate and when it is used? Okay, so first remember, magnesium sulfate is a drug of choice to prevent and to treat eclamptic seizure. Okay, but it does not reduce or lower the blood pressure. So that is why you have to give antihypertensive drugs separately. Okay, which we usually give labetalol. Indication, when do you use? First, it is if the blood pressure is more than or equal to 160 by 110. Okay, so we call it as severe preeclampsia. Number two, eclampsia, when the mother gets a seizure. Okay, number three, it is preeclampsia with severe features, like if the mother complains of headache, visual disturbance like blurring of vision, epigastric pain, pulmonary edema, elevated liver enzyme. That is when the mother complains of epigastric pain, lower platelets, and impaired kidney function. So mother will also complain of less urine output. Okay, and then you will also see swelling of extremities. Okay, so now let's see how to give magnesium sulfate. This is very important, and please listen carefully. So first is the loading dose. So in loading dose, the total magnesium sulfate that you will give is 14 gram. Okay, so it is 10 gram and 4 gram, it is 14 gram total. So how do you give? You give 4 gram in IV and 10 gram in IM. Okay, so now how do you give this? So 4 gram of magnesium sulfate, listen carefully, 1 gram of magnesium sulfate is of 2 ml of magnesium sulfate. The vial is of 2 ml. Okay, but the drug dose is 1 gram. Okay, so you have to give 4 gram, that means 4 vial that you have to break, and then you need to dilute it with the 12 ml of NS or distilled water, whichever you have. Okay, so 4 gram of magnesium sulfate has to be diluted in 12 ml of distilled water or NS. And then what do? You have to give it in IV. Okay, now this has to be given very slowly. It should be given within 5 to 10 minutes. It's we say it as you give it in 10 minutes. So if you have an infusion pump, use infusion pump, set a timer and use an infusion pump. If you don't, but you have to, here you have to make sure that you give it in 5 to 10 minutes. Do not push it rapidly. Okay, so this is one very important. Now 4 gram we have used it. Okay, so now 10 gram, how do you give? You have to give IV. You have to give 5 gram in each buttocks. That means 5 gram in left buttocks and 5 gram in right buttock. Okay, so the total becomes 10 gram. Okay, now here also what you need to do, when you are preparing the magnesium sulfate, first you need to draw this 5 gram of magnesium sulfate. So 5 gram means it is 12 ml. Okay, sorry, 10 ml. So in 10, what happens after that? In this 5 gram you have to even mix 1 ml of 2% lignocaine. Okay, because you are injecting 10 ml of magnesium sulfate. It is very painful, so that is why you also give lignocaine. Okay, so the lignocaine should be 2% lignocaine, and how much you need to draw? You should draw only 1 ml. Okay, so first you need to draw magnesium sulfate, after that you need to draw 1 ml of lignocaine. Okay, in the same 10 ml syringe, and you need to give in both the buttocks. Okay, so now this is loading dose. So loading dose is total of 14 gram. Okay, Now after that, maintenance dose you need to give. The maintenance dose starts after 4 hours of giving loading dose. Okay, so maintenance dose, if you give suppose if you give loading dose at 6 o'clock in the morning, suppose, and you need to give 6, 7, 8, 9, 10. Okay, at 10 o'clock your maintenance dose starts. So maintenance dose, how much do you give? You will be giving only 5 gram. So here 5 gram of magnesium sulfate has to be given alternatively, okay, in alternate buttocks. Okay, magnesium sulfate, the you have to, the course is of 24 hours. Okay, you have to give till 24 hours. So every 4 hourly you will be giving 5 gram of magnesium sulfate. Okay, and that too in a alternative buttock. Suppose you at 10 o'clock you give it at the left buttock, then 10, 11, 12, 1, 2. So 2 o'clock you'll be giving at the right buttock. So you need to document that. So at 10 o'clock it was at left buttocks, and then 2 o'clock it will be right. Okay, so left right till next morning 6 o'clock you need to give this magnesium sulfate dose. Okay, you have to continue till 24 hours. Okay. Okay, so now about toxicity. Okay, you have to check the toxicity every time you give the maintenance dose. Okay, so maintenance dose is every 4 hourly you will be giving the maintenance dose, that is 5 gram. So each time when you give a maintenance dose, before giving maintenance dose, you need to check for this 3 toxicity. The patellar reflex should be present, it should not be absent. Okay, respiratory rate should not be less than 16 breath per minute, it should be more. And urine output should be at least 25 ml per hourly, that means 4 hourly it should have at least 100 ml. Okay, any of these 3, any one if you find, you need to halt the magnesium sulfate maintenance dose. You should not stop, but you should halt for a while. Okay, so now here you see calcium gluconate, this is an antidote, but this is antidote of only for respiratory rate. If the respiratory rate is less than 16, that is when you give calcium gluconate. Okay, you will not be giving when it is when patellar reflex is absent, or when the urine output is less than 100 ml per 4 hourly. Okay, so you'll be giving only when the respiratory rate is less than 16 breath per minute. Okay, so how do you give? You have a 10 ml of 10% calcium gluconate, which is of 1 gram. Okay, the calcium gluconate you will be giving at the 10 ml calcium gluconate you will be giving at 10 minutes. In 10 minutes, it is not even 3 minutes, it should be given in 10 minutes. Okay, you should be you should give it very very slowly. Okay, so make sure that you have calcium gluconate in your facility when you are administering magnesium sulfate. Okay, so calcium gluconate, don't forget, calcium gluconate is antidote for respiratory rate if the respiratory rate is less than 16 breath per minute. For patellar reflex and for urine output, you need to just hold for a while. The magnesium sulfate actually it gets eliminated from the urine. So and then what happens? The patellar reflex gets back. Okay, so you have to wait for a while, and then you need to keep checking after half an hour and after 1 hour. Okay, so when it is present, then again you have to continue the magnesium sulfate for 24 hours. Okay, so now as a nurse, what all you need to monitor? Okay, so first, very important, that means that is respiratory rate. Make sure that respiratory rate is always or equal to, more than or equal to 16 breath per minute. Okay, the patellar reflex should be present. Okay, it is actually the earliest sign of toxicity. And urine output should be at least you should maintain it 30 ml or 25 ml per hour. Okay, and fetal heart rate, if the delivery has not happened, you need to continuously monitor the FHR, fetal heart rate. Make sure that the mother is in left lateral position. Okay, and you need to restrict fluid. Okay, because we have learned in the sign and symptoms what happens. There is a urine output is less. Okay, so you need to restrict fluid. Okay, and then seizure precaution has to be taken. You have to make sure that the side rails are there in the bed, suctions are available, ambu bags are ready. Okay, so and make sure that the environment is quiet and dim. Okay, and it doesn't stimulate the mother. Okay, and make sure that you keep the calcium gluconate available. Okay, so lastly, let's summarize it. So before giving each maintenance dose, you need to check for three toxicity, which is the respiration rate should be more than 16 or equal to 16 breath per minute. Patellar reflex should be present. Urine output should be more than 30 ml or at least 25 ml per hour. Okay, and there should be no sign of magnesium sulfate toxicity. If any criteria is not met, all these criteria is not met, then you need to withhold the dose. You should not stop but withhold it for a while, and then you need to notify it to the physician. Okay, so as a nurse, what are the takeaways? Magnesium sulfate, you need to know magnesium sulfate prevents seizure, not hypertension. That is why along with the magnesium sulfate you have to give even antihypertensive drug, that is labetalol. You need to start with labetalol. Okay, and then you always have to keep calcium gluconate ready, that because it is an antidote for respiratory rate. Okay, if the respiratory rate is less than 16 breath per minute. Okay, and then continue the magnesium sulfate for 24 hours. Okay, thank you so much. If you like it, please do share and subscribe.